As technology evolves, so do our options for health communications. The COVID epidemic put the need for new healthcare delivery methods in the spotlight, and many health professions embraced different forms of digital health communication during the pandemic as an alternative to seeing people in person in the office. So let's go over some of these digital health options. eHealth is the shortened term for electronic health. And so basically, it's just the use of digital tools and digital technologies to improve the way that we deliver healthcare and also to improve the way that we manage healthcare. You probably have access to an electronic medical record. If you are a patient with a medical organization at all, you probably log into your site and you might be able to see your labs and see your appointments that are scheduled. But some electronic medical records are going above and beyond in providing services to patients to help with their health and help manage their health. We also use electronic prescribing now. You rarely have to get a written prescription from your doctor. They send it right over to the pharmacist for you. And then telehealth is also a part of eHealth. Telehealth is just when you meet with a healthcare provider, but you're not physically in person. So it might be through your computer, it might even be through phone. So this is a screenshot of a portal to an electronic health record for people who are enrolled with the VA health services. So if you're a veteran, you have access to your health care through the VA services, and they have a very robust electronic medical record service that you can access. And so you would log in here, you would get your account and log in, and then that gives you access to all kinds of information to manage your health, to send messages to your various healthcare providers, keep track of your appointments. And there's also resources for you to learn more about your health. You have access to their health library. You can text this program that's AI generated, but it's a general medical question type texting. So if you have general medical questions, you have access to that. You can access a community of other veterans who might be dealing with the same circumstances that you are. So it's a very nice patient service that's all in one. When we think of telehealth, we tend to think of just having a basic doctor's appointment through a Zoom appointment, for example. But there's actually a lot that can be done through telehealth. We don't physically have to see people in order to help them. There's a lot of different health specialties that use telehealth that you might even be surprised. So for example, physical therapists can even use telehealth to do some of their services for patients. Eye screening can actually be done in home, in part, not all of it, but partially it can be done through telehealth. I have a screenshot here on the right side of an app that was developed for a nutrition counseling business run by dietitians. And so they use telehealth to screen patients, to do an initial assessment of their nutrition needs, and then they use telehealth to deliver the counseling that they determine is needed based on that assessment that they used. mHealth really falls under eHealth. mHealth just stands for mobile health, and these are digital health services that we deliver through personal mobile devices, which can be apps that people put on their phone or on a tablet, but it can also be wearable devices. And as technology advances, these become even more useful because your health care team is able to access some of these apps with your permission. And so these apps can provide information to your healthcare team about your current state of health. They can also be useful for your healthcare team in making a diagnosis and developing a treatment plan for you. So there are apps that are developed specifically for healthcare professionals to help them do their job better. Now, anybody can make an app, so we need to be very careful about which apps we use if we're working with people to try to improve their health. We need to make sure it's a reputable app that was developed by people who have actual expertise. This is an example of an app that was developed by the Texas Safe Babies team at the University of Texas. And so we know that it was created by people who had expertise. And this is called the Father's Playbook. So it's an app that is targeting a specific audience. And we know that in health communication, that is one of the best practices, is to target an audience. And so it's targeting new fathers. The idea of this app is to help them become involved in the baby's life during the prenatal time. And so during the time of pregnancy, there's not a whole lot for fathers to do. So this app actually helps fathers find tasks and ways to be involved and active in the pregnancy.